Hello, I'm Don Walker, and I am Communications Director for Brevard County Government, and we are here today for our bi-weekly update on the coronavirus pandemic and also information related to our Public Safety Department and other programs the county's working on in relation to COVID-19. On the panel we have today Maria Stahl, who is the Administrator for the Florida Department of Health Brevard. We have Interim Emergency Management Director John Scott. We have Public Safety Director Matthew Wallace. We have Catherine Allen, who is the Media and Publications Person for Brevard Public Schools. We have Brevard County Fire Rescue Chief Mark Schillmeyer. And we will be taking questions from our viewers. And we have Jesse Ray, our social media specialist, who will be monitoring your comments and questions and will pose those to us at the end of our program today. So we will lead off our program with Maria Stahl for an update on the pandemic in Brevard County. Maria?
Hi, good morning, everyone. And as Don said, I'm Maria Stahl, the health officer here at the Health Department in Brevard County. To give a quick recap of cases for today, statistics for today, we're up to 18,302 cases. We did add 216 cases, and let me reiterate by saying these are actually yesterday's numbers because today's numbers are not published yet. We had a positivity rate of 7.89%. Overall, since the beginning of March when we began testing, is 11.14% positivity. We did add one more death. We are up to 484 deaths in our county. Our hospitals, as have been all along, our hospitals continue stability and having space. There's currently 86 individuals in all of our hospitals that are COVID positive. When looking at a 2-week span, which is really the more accurate thing to look at, is either on 1 week or a 2-week span, to avoid the fluctuations from day to day. We've had a total of 6.7% positivity over the last 2 weeks, and that is actually a little bit better than when we reported out 2 weeks ago. Our deaths increased by 39, and our overall deaths are somewhat pretty stable as far as the age breakdown. 57% are related to long-term care facilities. 39% are over the age of 85. 33% are between the ages of 75 and 84. 16 are between 65 and 74. So total 88% of our deaths are over the age of 65. The median age of our cases remains in the 40s. And then I'll go on and talk a little bit about the vaccines. We are very, very excited, as we talked 2 weeks ago, about the vaccines beginning to be rolled out in our country as well as our state. Hopefully the EUA will be given for the Moderna vaccine, which will increase the vaccine availability even a little bit more. As John and I talked about at the last Facebook Live, it's really important that everybody is patient, and we are going to follow the governor's phasing plan. Right now we are in phase 1A, which is healthcare workers in the hospital that are dealing with the COVID patients, as well as long-term care staff and residents. We do anticipate that our hospitals, all of our hospitals in Brevard County, will receive some Moderna vaccine if the EUA is given for that next week. The long-term care facilities will also be starting to get vaccines through CVS and Walgreens in the next week. So as John said, it's a long tunnel, but there is definitely light at the end of the tunnel, and here in Brevard County, we will be seeing vaccines hopefully next week. So thank you, Don.
All right, thank you, Maria. And for some more information on the pandemic and the county's response, we have Interim Emergency Management Director John Scott. John?
Thank you, Don. Good morning, everyone. Again, my name is John Scott. I am the Interim Emergency Management Director for Brevard County. want to hit on a couple of things, as I know there's a lot of information out there. But first, I want to start with we're getting ready to go into the holiday season, and it's critical that during this period of time we really focus on maintaining our good, strong COVID countermeasures. We know that this time of year is typically cooler, so obviously we're going to be indoors more, and we're also going to be around family and friends. So we want to make sure we're practicing good hand hygiene, we're wearing masks, we're practicing social distancing, and we're really trying to avoid large crowds. As we talked about during Thanksgiving, there are safe ways for you to gather with friends and family and still have, a holiday gathering. Now, like with all things 2020, it's going to be different than what it normally is, but there are still a lot of ways to do things safely. So do things like, if you are gathering, try to get in smaller groups. If it's possible to be outside, be outside. If you can't be, try to social distance inside. If you're having a holiday meal with friends and family, make sure you're really taking precautions, that you're not doing it buffet style, that it is, maybe you establish one single server to provide those kinds of things, and that you are limiting multiple contacts on a bunch of different surfaces. The CDC continues to provide great information about how to do holidays safely, and we would refer you to that. Secondly, I want to talk about the vaccine, because that's the exciting thing that we're all really focused on right now. And as Maria said, we do see that light at the end of the tunnel, and there's absolute reason for optimism for the first time in a really long time when it comes to getting back to normalcy. When we talk about the vaccines, I know there's a lot of misinformation, a lot of confusion on that, so I wanted to clear up a couple of things. So one, Pfizer is the vaccine that's been approved and is currently being distributed across the country. Two, Moderna, as Maria said, is the next one slated for approval, and we expect and hope that happens this weekend. That will give us some vaccines in our county for our hospitals next week. But both of those vaccines are something called an mRNA vaccine, and there are a lot of questions about it. So let me start with a couple of things. One, any vaccine you get with COVID will not give you COVID. Does not contain the virus. You're at no risk of getting COVID from the vaccine. Two, all the new vaccines, both Pfizer and what the early stuff says on Moderna, will be safe and are effective. And that's why we're waiting for that approval on the Moderna from the FDA, saying that it is indeed safe. So those are things we can count on and things we're looking forward to. We talk about what it does. There's been some questions because the mRNA vaccine is a new technology. It doesn't do anything to your DNA. Just because it has RNA in the title doesn't mean it messes up your DNA. You will be fine. We talk about sort of what that new technology is, and a lot of folks who I've spoken to are concerned, hey, how do we get a vaccine so quickly? Is it safe because we got it so quickly? Let me hit just a couple of points on that, and while I'm obviously not our epidemiologist or a scientist on those things, I listen very closely when those folks talk. And the big difference, and one of the reasons why we were able to get a vaccine so quickly, is really because of the amount of resources that the entire world has poured into this effort, both from a funding perspective, and we've got researchers across the globe sharing their information, sharing their research, and sort of a free way, and in a way that's never really happened for one single issue before. And so we have a lot of folks globally who have prioritized as we've got to get to a solution. So they've really leveraged those resources to get us here this quickly. And then the second piece is that newer technology. Because science has made such significant breakthroughs in the last 10 years about how we approach medicine in general, just something as complex as decoding the human genome really has allowed us to expedite these vaccines. So we get a safer vaccine, we get a faster vaccine because we have a blueprint for both how humans work and how the virus works. So it allows very quickly for scientists and our medical professionals to diagnose how COVID is structured and then what we can do in our body to protect us from COVID. And then it's just a matter of going through the trials. So these have been tested, and these have been, we've gone through those things. So again, it's a safe, effective virus, and it's pretty exciting to be a part of when you think about the effort that it's taken to get us here so quickly. I will also talk about the idea, when it comes to the dosage. Both shots right now, both Moderna and Pfizer are 2 shots, and it's important to get both. We get the original shot and then you get a follow-up shot because that's really going to be what helps your body build those antibodies and build your immune system, and then that second dose really gets in there and fortifies it. So we need both. And there are questions about, am I going to feel some side effects from that? What's that look like? Yeah, likely, the trials have shown us that people may spike a small fever, may feel achy, but those are fairly mild in the world of side effects. And really what that's telling you, that's your body telling you that the vaccine is working, that your body is producing the antibodies we were hoping to achieve. So all of that is really encouraging news, and there's a lot of information out there. The CDC has great resources. I think we can show a couple on the actual page. Jesse, if you'd be so kind.
Yes.
Logan. There's a lot of information out there. What we really want to stress is go to the source, go to the CDC, go to the Department of Health, get good, strong information, read everything that they're providing. That's our trusted source. Those are our verified sources, and we're showing you just an example of the kind of information you can find on there right now. And all about vaccines, all different categories. Go there, get educated on it, be informed so that you and your family make the best decisions you can with the best information that's out there so that you feel comfortable. Again, the vaccine is our pathway to normalcy, so we've got to make sure we're doing it. We want to make sure we're doing it so that everybody feels comfortable. So again, that website is there for everyone. Please feel free to refer to it. So the last thing I want to just sort of say to everyone, and you heard Maria talk about it, this is a phased approach because we have limited doses. As more doses become available, we're going to be able to expand the groups that get it. But we really need everyone to be patient. And we've had a lot of questions from residents when we talk to them about, hey, how can I help with this process? What can I do to make a difference as we're trying to recover from COVID? And quite frankly, one of the best answers, one of the best things you can do is wait your turn, wait till we get to your group for the vaccine, and then get the vaccine when you're comfortable. Like those kinds of things are, again, how we can help each other so that we get our priority groups vaccinated, our most vulnerable folks protected from the virus as soon as possible, and then let's work out to those different groups. So thank you, everyone, for your continued diligence. We know this has been an extremely long road. We're just asking, hang in there with us a little bit longer. We have hope on the horizon, and just do your part, wait your turn. Thanks. Don?
Thank you, John and Maria, for those updates. As I've mentioned in previous Facebook Live events, the county received $105 million from the U.S. Treasury Department early on in this pandemic, as did many counties throughout the nation, that they could use to help create some type of relief programs for businesses and citizens in the community. And obviously, we benefited through that program as well, and have worked very hard to help those that have suffered in our community as a result of financial losses related to COVID-19. One of the things the county's been doing is helping distribute free personal protective equipment to small businesses, retailers, and restaurants, because we know they need that gear to maintain their business as best as possible. We have another PPE distribution that's planned for next Tuesday, December 22nd, that will run from 10 to 1, and we will be giving out supplies there until we run out. So that's the last one planned for this year. So if you're a small business, retailer, restaurant, and you need PPE for your business, Tuesday from 10 a.m. to 1 p.m. at the Emergency Operations Center on Cedar Street in Rockledge, and we will be distributing that PPE until our supplies run out. For more information on our CARES Act money, Matt Wallace, the Public Safety Director, is here. And Matt, I will turn it over to you.
Hi, good morning, everybody, and thank you, Don. Thank you, Brevard County, for, again, tuning in with us this morning as we get information out to you all so you can make great educated decisions for you, your families, and your loved ones. I find it optimistic, again, that we have now started the conversation about vaccines. And John Scott, I can't tell you how much I appreciate you taking the lead and getting that information out and working that as hard as you have with the Department of Health and with the state of Florida and with our federal partners and all our partners across the county. It's a good sign, as John Scott said, but please be patient as we work to that. As Don said, that we do have federal CARES dollars that were given to us back in the springtime, and we've had multiple programs that those CARE dollars have been taken care of to get those dollars infused back to the community, back in the hands of our residents who really need them. As you know, we've had a small business program, individual assistance programs, and some food stability programs that we saw were extremely successful in the last multiple months that we've been engaging in those programs and operationalizing those programs. But as I look at my watch, today is December 17th, and the current federal guidance shows that those CARES dollars will be expiring at the end of the year. So as we sneak up on the end of the year, some of our programs also, we will see those programs end. In particular, the small business closeout date will be tomorrow on December 18th. That is tomorrow, right? Today's the 17th. All these days kind of blur together from time to time. And our last farmers market will be this weekend. The other individual assistant programs and other financial programs that we have, we'll work those hard, but we expect to see those being closed here too as the calendar rolls around. Now, this all could change based on the federal guidance that comes out, and please continue to watch the news and in the paper and the internet and get your information sources about what the federal government is doing in these stimulus checks and these stimulus programs, because this guidance could change, and if those do, then we as a county will absolutely offer those opportunities up as maximum as we can, depending on what the stipulations are of those programs. So again, please bear with us. Please watch the news. Please continue to watch these Facebook Live events that we have as the county, because our main job as county staff is to make sure that we give you the resources and the information to all our county residents and to all our visitors across this county that you can make appropriate decisions. The website that you can go to, I don't know if we can put that up there, it has not changed since we've started. It is brevardfl.gov/Brevard Cares. All most current information that we have on any of our assistance programs can be found there. Please continue to check out that website, again, as the stipulations may change and the guidance may change from the federal government. As soon as we hear anything or as soon as any updates are made, we will be posting on those websites as well as the emergency management Facebook pages, the Brevard County Facebook pages, as often as quick as we can get that information out. But that website is probably your main link to make sure that you stay informed. That's all I have. I know we're coming up on holidays, and I wish everybody a very Merry Christmas and very happy holiday season. Please be safe. And as we close 2020 out, I think there'll be a bigger joy this year maybe than ever before as we move maybe into a new year and a new opportunities in 2021. I know if y'all are like me, I'm ready for 2020 to be ending. So, Don, I'll pass that back to you, buddy.
All right, thank you, Matt. And we have today with us Catherine Allen from Brevard Public Schools, who will give us an update on the school system.
Thanks, Don. Thanks, everyone. Again, my name is Catherine Allen, Media and Publications for Brevard Public Schools. Recently on our dashboard, we have seen just a little bit of an increase in our cases. We still distribute the dashboard twice weekly. Those are available at www.brevardschools.org/COVID-19. We do want to make sure that our families and our community are aware that the last dashboard for the 2020 school year will be this Friday, tomorrow, as we will be breaking for the holiday break and close down from December 21st through January 1st. A couple of exciting things. The USDA program recently extended the summer feeding program through June 2021. So all children in our community in Brevard County, ages 18 and under, have access and are available to receive meals. They do not need to be a public school student. So any child that's 18 or under, those are available. Information on meal pickup locations, days, and times, they can all be found on the website, again, brevardschools.org. There will not be meal distribution during the holiday break. Again, Brevard Public Schools will be closed December 21st through January 1st. But we do have two other resources that would be great options for families during that time. The first would be Brevard 211, so that's www.211brevard.org, or you can call 211 and they are happy to help you find food pantries or other food sharing options. You can also contact Second Harvest Food Bank. On their website, you can see options that are available to you in your zip code. And we're also excited that the Florida Department of Education officially approved e-learning for the second semester. I know that was a big concern for a lot of people in our community. We do have over 20,000 students that have continued to e-learn at home. So that's something that we're excited. We really want to make sure that we take a quick opportunity to say thank you to the parents who've helped their students, to the teachers that are making this happen, our ed tech people. It has meant a lot of extra hours. It's creating new curriculum. It's finding new ways to engage students in ways that we haven't had to do before. A lot of long hours, a lot of hard work. So we're really excited that this holiday break is coming up. I'm sure parents are excited, students are excited, and of course our staff. So hopefully everybody has a restful holiday break. Lastly, we just want to really encourage our families and our community, just to reiterate what others are saying here. Yes, it's the holidays and it's a wonderful time of year, but please, continue to be vigilant with, hand hygiene, hand washing, social distancing, wear your masks, limit, your exposure if you possibly can. And we look forward to seeing everybody back on Monday, January 4th.
All right, thank you, Catherine. Before we turn it over for questions, we are not all COVID all the time, so we have Mark Schellmeyer, the Chief of Brevard County Fire Rescue, here today to give us an update on fire rescue. Mark?
So 2020 has been quite the year, as we've gone over before, and I promised I wouldn't mention the word COVID in my report, and so I'm not. And so I do want to start off with a little bit of holiday safety. I know John Scott had mentioned about COVID and the holidays and gatherings, but a little bit of holiday fire safety as we get into the Christmas holidays. And those of you that have purchased live trees, it seems like live trees were going on sale right after Thanksgiving, and so they should be nice and dry right now. And so just a reminder to water your trees regularly. If you brush up against your tree and there's hundreds of needles come off, it is already too dry, so check it regularly. They do use up a lot of water within the first couple weeks that you have them, and take them down right away shortly after the holidays. Do want to move into some really good news for 2020. Brevard County Fire Rescue is in receipt of 2 brand new 2020 Sutton custom fire engines that we had delivered to our fleet services last week. They will be going to Station 87 in Valkyria and Station 22 in Mims. And they should be in service after the first of the year. They're going to get equipment mounted on it, radios mounted, and we should announce a push-in ceremony, which will be, to be announced depending on the status of COVID. So look out for that. Check us out on social media, and thank you.
All right, thank you, Mark. All right, I'm going to turn it over to Jesse Ray, the Brevard County social media specialist, who has been monitoring the Facebook Live feed. And Jesse, do we have any questions today?
We do. So for those of you who are watching, try and stick with us during these. I know that the comments can be pretty overwhelming, and to my team that's here, we might go over the noon timeline that we usually have, but I want to make sure we get through as many of these as we possibly can so that we can make sure we are reaching our audience. So to start, Maria, do you have some specific timelines for when the COVID-19 vaccine might be available in Brevard?
Well, we have been told if, as I had said, if the Moderna vaccine receives its EUA, we are fully expecting vaccine to be next week coming to Brevard County specifically for the hospitals, for the staff in the hospitals. In addition, there will be vaccine coming to Walgreens and CVS, and I'm anticipating by next week also to begin immunizations with the staff and residents of long-term care facilities.
Okay, thank
Jesse,
you.
can I just follow up on that?
Absolutely.
Just on a couple of things, Maria mentioned it's coming to Walgreens and CVS. Again, that's part of that long-term care facility partnership. Mm-hmm. And yeah, you can see the vaccine is beginning to start to roll in for us, but I'm going to take every opportunity I can to remind folks to please be patient with us as we get through this. We want to get it to the general public as fast as we can, but limited doses are going to drive the fact that we hit those priority groups, those most vulnerable first. So that's why you keep hearing us ask for patience through this. But also be assured that as soon as humanly possible, we will get to the general public.
And when do you think that will be?
It depends on available doses. It's going to depend on how many more vaccine companies get approved in the coming months. We expect a couple more. We expect AstraZeneca and Johnson & Johnson to come online sometime in the first part of 2021. I think if the standard we're talking about is want a vaccine, get a vaccine widely available, then a good planning assumption is late spring, early summer.
Okay. So 2 weeks ago, Maria, you said that we needed to wait about 2 weeks to see the impact of the Thanksgiving holiday weekend on local COVID-19 cases. So it's been that 2 weeks. What have you found, and are there any new recommendations for Christmas and New Year's gathering other than the basics that we've been mentioning before?
Okay. Well, that's a twofold question, so we'll start with our cases. I can actually say from 2 weeks ago till now, I don't see cases have increased. Cases are not low, however. Cases remain at a stable high level. So we're at a stable high level. So I can't see that we've really seen this surge from Thanksgiving. But remember, however, we're talking cases, contacts to cases can be 2 weeks, 2 weeks, 2 weeks. So, there still could be some fallout. But the overall positivity rate that we have seen about 2 weeks ago was 7 point something. I don't have the exact number in front of me. And our last 2 weeks was 6.7%. So I see it more stable than increasing, but stable at a high level.
Right.
We're definitely stable at a high level. The second part of the question, what was this? I'm sorry, what was the second
you're
part
good.
of the question?
Are there any new recommendations for Christmas and New Year's?
I think John pretty much covered that. The recommendations are the same as they've been all along. Minimize our contacts, especially contacts outside the household, if at all possible. Wear your face coverings, wash your hands, social distance. It's the exact same measures we've talked about all along, and just be very, very cautious, especially if you're with groups greater than 10 and indoors.
Okay, awesome. Is there word of a vaccine for those who have allergies or are immunocompromised, who maybe otherwise don't usually get certain vaccines?
I'm not really sure of the question. Any of the vaccines, if you, well, at least the Pfizer that's out now and the Moderna probably that's going to be coming out. The big thing is allergies to any components to the vaccine, which is the exact same contraindications for any vaccine that we get. So that's the big thing. If you have severe allergies, outside of the components, I would get the approval of your physician to get the vaccines. As far as, is there any vaccine for people that have allergies? No, it's going to be the vaccines and the components to the vaccines and your doctor's recommendations.
Okay. Sorry, I'm trying to get through these. So when should you consult with your doctor before receiving a vaccine? You kind of started to touch on that a little bit.
Well, the big one, right, the allergies, and if you're pregnant or lactating.
Okay.
Those definitely are reasons that you would want to consult with your doctor. But of course, any time that you want to have a comfort level in receiving vaccines, definitely consult with your physician.
Okay. And how long does the vaccine last? Do we really have an idea, or are we waiting for more data on that?
You definitely need to wait on more data, so we really do not know that. They will continue to be doing studies, long-term studies, so there'll be more information on that.
Okay. Do we think that the snow up in the northern area of the country is going to delay the shipment of the vaccines?
I'll take that one, Jeff.
Sure.
No. The short answer to that is no. Operation Warp Speed, which is a large federal initiative where they really spent the last 9 months building a strong supply chain. I mean, weather's going to may delay things hours, or something like that, but I don't think we're talking about gridlock or anything like that. Again, I will continue to say it. Everyone's goal who's in the public safety business is to get doses out as fast as possible. So as they're produced, as they're deemed safe, they're getting out to folks. So I mean, I feel very, very strong, or I feel very, very confident in the strength of the supply chain.
Beautiful. Maria, Do you know of any hospitals that are at capacity for their ICU beds?
There's no hospitals at their capacity at this point,
Okay, all right.
nor has there been,
Right.
throughout.
Good. And I know that we've talked about this before, but maybe for some of our new viewers, can you talk about recoveries a little bit and why we sit here and discuss, the numbers of how many people have it and how many people have died, but we don't talk about how many people have recovered from it?
We don't talk about how many people recovered from it because there's so many, I think I've talked about this on other Facebook Live sessions, but there's so many different ways to capture recovery. So our state truly does not look at the pure recovery. We just tend to focus on the individuals. And the recovery truly is 10 days out from the date your symptoms start or the date of a positive test, as long as you're 24 hours without a fever. So that is the true recovery, but we do not capture the recovery numbers as a whole.
Okay. Matt or Don, one of you might be able to, or John, is PPE open to churches or is it just small businesses, retail, and restaurants?
John, do you?
The short version to that is it's primarily designed for the business world, those small businesses. That really was the point of it, to target that group. If we have churches with a significant need for some of their daily operations, we certainly want to help our nonprofit partners and our community organizations. If the idea is, can we get enough masks for all of their congregates, then that's probably not something we can do. But if they run food kitchens and food banks and childcare, then yeah, absolutely, we want to help where we can, and they can contact us at the Emergency Operations Center, and we will do our best to assist them. But there are limits to it.
Okay. So the situation, of people being unemployed at the time, of course, is we have people who are concerned, how do I get a vaccine if I'm currently unemployed and have no insurance, so I can't go to the doctor, and I'm autoimmune, so I need to see a doctor before I get the vaccine? Do we have any suggestions for people that are in this situation to help them be able to get the vaccine and with a recommendation from a doctor?
Well, the vaccine itself will be free.
Right.
So there is absolutely no charge for the vaccine. If you're in the category, like I said, the pregnant, the lactating, immunocompromised itself is not a reason not to have a vaccine. It's going to be allergies. But if you truly feel that you don't have health insurance and you want to be evaluated by a physician or a healthcare provider before you get the vaccine, we have 2 organizations in Brevard County that see uninsured individuals. And the first is Brevard Health Alliance, and the second is Space Coast Volunteers in Medicine. So both of those places do see uninsured individuals if you feel you want any medical evaluation before you get the vaccine. But truly the only, the pregnant, the lactating, and the severe allergies are the only ones that really need the evaluation.
Okay, and this is the last one I'm going to take for today. I'm just checking our YouTube really quick. So when it does finally get opened up to the general public, how long do we think until children are going to be able to get them? Like, are children going to be allowed to get them as soon as it's open to the general population, or is this something?
That is truly going to depend on the EUA and the ACIP and the studies that are currently have been done with the vaccine. So the Pfizer vaccine right now is for ages 16 and above. The Moderna, when that comes out, is going to be 18 and above. And that's purely related to the studies and the trials have not been done on enough of the pediatric population to determine that it's okay. I do not know on the next vaccines possibly coming up or even additional trials that are currently occurring with the Pfizer and the Moderna when that will be available.
Okay, I lied. We're going to do. Go ahead, John.
I just want to follow that with, that's an important point, which is we're going to continue to learn more about COVID. We're going to continue to learn more about vaccines and where they work, where they're effective, things that can be done, what groups are, like studies are going to continue to go. Like it's not just we're good and this is the information going forward. We're going to learn a whole lot more between now and January and the more in February and so on. So what we know today will improve and evolve as we go forward. So we may not be able to answer that question 100% today, but if we're talking general public in late spring, early summer, we might have that information then. So again, just ask that everyone continue to stay informed on the subject.
Okay, so I lied. A couple more things. Sorry, they're coming in quickly. John, you might be able to kind of take this. Are we going to set up stations for free vaccines, much like we did for the free COVID testing? Are we thinking something like that might happen here in the future?
So when it comes to strategies, to what our general strategies are, everything's on the table. We'll look at when we have small doses, partnering with groups to get it to those vulnerable, high-priority groups in specific ways. When it is widely available, we'll look at the best way to distribute it. We are, and the federal government has, and we have strong partnerships with our pharmacies and our medical community. And ideally, we're going to get the vaccine out to where people are used to going to get their vaccine. We know that between our doctor's offices and our pharmacies, and that gives us much better coverage countywide to reach people who may not always be able to get to a central location. So everything is on the table, but primarily we're going to be focused on getting it out as widely as we can. And if the best strategy for that is our pharmacies and our medical clinics, then that's what we're going to utilize.
Okay. So just for the time's sake, I'm going to try and clarify a couple of things, and you're welcome to interrupt me if I get anything wrong. To clarify what Maria said as far as the vaccine is free, the vaccine is free, but or doctors' offices are allowed to charge an administrative fee for you coming in and getting those vaccines. So yes, the vaccine is free, but you may still have to pay a copay or whatever the administrative fee is. So hope that answers your question there, Amanda.
That is absolutely correct. I can say when we have vaccines at the health department available, we will not be charging an administrative fee.
Okay. And then also just to repeat that we are currently in phase 1, and the general population being able to get the vaccine is not until phase 3. And we will probably be in phase 1 for a hot minute, and then phase 2, and then phase 3. So I know that we've talked about the general population, but that will not be available until we hit phase 3, which currently we are believing is sometime early summer as far as it looks right now, but that of course could change. But early estimates is that phase 3 general population will be available starting early summer or so. But currently we are in phase 1, which is mostly just doctors and healthcare.
It's healthcare workers and it's long-term care facilities, and then we'll start to talk about those that are 65 and older with significant comorbidities or underlying health conditions.
Right.
Right.
So.
And then we'll move to other, high priority groups in that phase 2 timeframe where we're talking first responders, essential workers, critical infrastructure workers, those that are still, again, a higher priority when it comes to the level of interaction they have or possible exposure with COVID. And I will continue to hit. As doses become available, so if production ramps up and we have a lot more available than we anticipate today, we'll get to the general public faster. But at this time, we want to be cautious in what we predict. We want to make sure that we can deliver on what we say we can. So that's the goal.
Okay, so the other questions that I've gotten, I feel like we have discussed at the beginning of this, so please, if you missed any of the questions, go back and rewatch this live once it posts here in just a minute, because we're going to go ahead and wrap up so we can all get on with our day. So Don, back to you.
Okay, and so we did go a little longer today because, number one, we have the upcoming holidays, so we wanted to try to get as many questions in as possible before we head off to the holiday season. But we will be back after the first of the year. Our first Facebook Live event is now planned for January 14th at 11:30 a.m., so please join us then if you can. And until then, please have a safe and happy holiday. Thank you.